Tonight, the future of Arizona's Medicaid program is up in the air because the system that finances it needs legislators to reach an agreement to spend more than $1 billion to cover expenses through the end of June. Thanks for joining us tonight. I'm Mark Curtis.
And I'm Kariba Devine. Colleen Sikora spoke with lawmakers on both sides of the aisle who agree that it needs to happen, but don't agree on how it should get done.
Since the beginning of the pandemic, the number of people in the state's Medicaid program has increased by more than a third to 2.5 million members. And in a letter, it's because of that increase, Access is asking the legislature to allow them to spend a total of more than $3.3 billion through June. Half of that money was funded last month, but the rest?
We're talking about 2 million Arizonans. Our business's ability to take care of them and how we pay for that is up in the air right now because of both the governor's office and the legislature not coming together and recognizing this is a priority that needs to get done right now.
Leaders on both sides of the aisle agree that the state's Medicaid program needs this money.
Ready to fund it today. We want to fund it.
We need to take care of it right now.
But they don't agree on how to do it. Republicans want it as part of the state budget and included it in a budget that Governor Katie Hobbs already vetoed. Democrats want a standalone bill.
We're ready to do it today. The Republicans are literally ready to do it today. We're ready to put a budget on her desk today. But we're waiting on her, and we're waiting on the Democratic caucus.
I definitely hear you guys are ready and you guys are waiting on them. Do you think it'll get done in time before providers aren't getting paid?
I can't speak for them. You would have to ask them.
Is it just going to come down to kind of going back and forth on the budget?
There are sick people in hospitals who need this money. There is no reason to wait for a budget to do this. We do not need to negotiate this as part of the budget.
Peterson says budget talks are ongoing.
If that's not an option, we can talk about alternatives.
Still leaving hospitals and healthcare providers wondering what's next.
We have hospitals saying, what do I tell my CEO? You know, they're trying to understand how much upfront costs are we going to have to make? And that's of a big concern to them.
While Access has not responded to our request for an interview or comment, Danny Seiden, the Arizona Chamber of Commerce's president and CEO, says he's seen the legislature make agreements on this before.
But right now, a deadline passes and everyone's quiet, everyone's playing the blame game. That's not helpful. What's helpful is just getting this done.
Colleen Sikora, 12 News.